The new multi-million-dollar Wellstone Crisis Center is finally set to open this summer. That's around the same time a new law will go into effect that expands the parameters a person needs to meet in order to get mental health help. WAAY 31's Alex Torres Perez joins us live now with a breakdown of that new law and the resources available to help people even after they go through a crisis. Alex?
The main goal of this law is to make sure people have access to treatment. It will no longer require someone to be a threat to themselves or someone else in order to be committed to a facility, but there is a concern that there aren't enough beds available. But thankfully, as you can see behind me, there is work underway right now to make sure that changes.
There are not enough beds. That's the truth.
Madison County Probate Judge Frank Barger says there are less than 400 beds across the state. Just over 50 are in Madison County, but
we don't have 50 beds just for Madison County. We end up servicing the North Alabama area.
The pandemic is also causing an uptick in mental health problems. Judge Barger says he saw just under 400 petitions to get people committed last year, when they usually see around 325 per year.
All of those don't move to an inpatient treatment.
But the rise in cases is causing state lawmakers to take action, with more funding approved to help those suffering from a mental health illness and to build 4 new crisis centers across the state, including one here in Huntsville.
We're going to effectively double the number of beds.
Wellstone Behavioral Health CEO Jeremy Blair says they hope to open their crisis center by the middle or end of the summer. Patients usually stay in a bed for around a week, but can stay longer if needed. Then they can be transferred to outpatient care.
That is where we fall short.
That's why Judge Barger created the Assisted Outpatient Treatment Program in 2019. It's funded by the $35 fee people pay to get a passport. The money funds 2 full-time case managers who check in with stabilized patients for around 5 months.
Give them the experience that they can manage their mental illness on their own, that there are resources and a community available to care for them.
Judge Barger says seeing the impact it's already made in people's lives makes the entire program worth it, and hopes everyone who needs it takes advantage of it.
We need to treat mental health just like we would any other health condition. Just like no one chooses to have heart disease, no one chooses to have cancer, no one chooses to suffer with mental illness.
Now, as of last week, 63 people went through that assisted outpatient program. Judge Barger told me that less than 10% of that group have gone back to the courtroom to be committed again. Reporting live in Huntsville, Alex Torres Perez, WAAY 31 News.